If you are packing your bags to study abroad in the next few weeks, your most urgent task has nothing to do with housing or course registration. It is your health insurance. Getting this wrong has immediate consequences. In Germany, university enrollment is completely blocked. In Italy, you face formal deportation warnings. And in the United States, your tuition bill will automatically jump by thousands of dollars. We are going to break down exactly how to navigate the complex immigration laws and university mandates for the 4 major study destinations, giving you the exact steps you need to take right now. Drop your specific destination, the USA, Germany, Italy, or Australia, in the comments below, and we will send you tailored advice for your situation. Securing international student health insurance requires checking legal and financial boxes. It dictates whether immigration will let you cross the border, and whether your university will let you step foot in a classroom. We start with Germany. German universities strictly ban paper insurance certificates. Showing up at the registrar with a printed policy will get you turned away. The default path is straightforward. If you are under 30 and enrolled in a degree program, you are required to use public health insurance, known as GKV. It costs roughly €110 a month and covers almost everything. You might find a private insurance plan that costs €30 or €40 a month. To use it, the German government requires you to obtain a formal exemption certificate, a Befreiung, from a public provider. Filing that exemption triggers a permanent ban. By opting out of the public system to save a few euros your first semester, you are legally locked out of German public healthcare for the entire duration of your studies, no matter what medical conditions you develop later. To avoid this trap, contact a public provider immediately. Give them your passport, admission letter, and your university's sender number. This diagram outlines the M10 protocol. The Public Insurance Fund sends a direct data packet to your university's database. This digital handshake verifies your status, bypasses the paper ban, and clears you for enrollment. Choosing a budget private plan in Germany leaves you with massive out-of-pocket risks down the road and adds layers of bureaucracy to your digital enrollment. Moving south to Italy, the immigration laws tie your status directly to your health coverage. Your permesso di soggiorno, your residence permit, cannot legally outlast the validity period of your health insurance. Many students buy a cheap 90-day travel insurance policy thinking it will cover their arrival. Italian embassies regularly reject student visas that use short-term travel policies as proof of coverage. The most comprehensive option is the Italian public healthcare system, the SSN. For international students, it costs a flat fee of €700 per year and grants you the exact same healthcare rights as an Italian citizen. This timeline illustrates the SSN trap. The Italian system operates rigidly from January 1st to December 31st. If you arrive in September, you pay the full €700 for 4 months of coverage. On December 31st, it expires, and you owe another €700. Paying the tax form online is only step 1. You have no coverage and no doctor until you take your physical payment receipt to the local ASL health office and register in person. Here is the optimal workaround. Buy a specialized private student policy for your initial visa application. Once you arrive, wait until January 1st to pay the SSN fee, maximizing your €700 investment for a full 12 months. Misaligning your policy with the calendar year drains your bank account and leaves gaps in your coverage. A gap in coverage during your permit renewal will trigger a formal deportation warning from the local questura. Navigating the German M10 system or Italian ASL offices requires specific paperwork. We have step-by-step instructions for both processes at itstudent.com. It takes 3 minutes to read and will save you weeks of dealing with foreign embassies. In the United States, universities take control of your billing. If you ignore the health insurance emails from your American university, they will default to auto-enrolling you in their student health insurance plan, or SHIP. That automatic enrollment adds between $1,500 and $3,500 directly to your semester tuition bill. F1 visa students on a budget can legally buy external international student plans for roughly $500 a year. Opting for an external plan means you must aggressively navigate the university's administrative waiver process. You have to provide documentation proving your external plan matches their specific criteria, including high limits for medical evacuation and repatriation. This chart highlights the financial reality of the US system. A routine medical visit costs $200 if you go to an in-network doctor. If your cheap external plan has a poor network, That exact same visit can cost $800 out of pocket. F1 students have a bit of leeway with the government, but J1 exchange students do not. If a J1 student lets their insurance lapse, federal law requires their university sponsor to terminate their SEBIS record, effectively canceling their visa. Log into your student portal today, locate your university's SHIP waiver deadline, compare their minimum requirements against external providers, and submit your waiver at least 30 days before your first class. Missing that waiver window guarantees you will pay thousands of dollars in unavoidable, non-refundable university fees. Australia operates on a strict, unyielding timeline for international students. This flowchart illustrates the visa sequence. You are required to purchase and activate your Overseas Student Health Cover, OSHC, before a student visa application can even be submitted to the government. OSHC is mandatory for standard doctor visits and emergencies, but leaves holes in routine care. The mandate provides zero coverage for dental or optical care. If you need a cavity filled or glasses, you pay the entire bill yourself. Calculate the exact duration of your degree program, plus the post-study months allowed by immigration, and purchase an OSHC policy covering that entire time frame before you open the visa portal. Trying to apply for the visa before securing your insurance results in an automatic rejection, and ignoring the coverage gaps leaves you paying out of pocket for standard dental and eye care. Across all 4 of these countries, health insurance is a non-negotiable legal gateway. In the US, you are fighting the university waiver clock to avoid massive fees. In Germany, initiate the M10 digital handshake so you can actually register for your classes. In Italy, you have to balance your policy against the SSN calendar trap. And in Australia, you cannot even apply for a visa without an OSHC certificate in hand. Here is your final checklist. Germany, contact a public provider for your M10 notification. Italy, buy a private policy for the visa, pay the SSN in January. USA, submit your SHIP waiver 30 days early. Australia, buy your OSHC for the full duration of your stay today. For the specific links, provider comparisons, and waiver forms, head over to itsstudent.com. Tomorrow, we are breaking down the specific campus culture and employment data for RIT Rochester, so make sure you are subscribed. Sorting this out takes a few hours of reading fine print, but completing these steps now guarantees you will arrive